A new drug can lower bad cholesterol by up to 58%, according to results from a recent international clinical trial testing enlicitide decanoate. This once-daily pill was given to nearly 300 adults with heterozygous familial hypercholesterolemia, or HeFH, a common inherited condition that causes high levels of LDL cholesterol from birth and dramatically increases the risk of heart disease. Despite already taking statins, participants in the trial still had dangerously high LDL-C levels. After 24 weeks on the new drug, their LDL cholesterol dropped by an average of 58.2%, while those on a placebo actually saw a slight increase. Even better, the treatment continued to perform well over the full 52-week study period. Side effects were minimal and similar between the drug and placebo groups, and the pill proved easy for patients to stick with. 98% of them took it as prescribed. Enlicitide works by blocking a protein called PCSK9, which normally limits the liver's ability to clear LDL cholesterol from the bloodstream. By keeping this protein in check, the drug allows the liver to do its job more effectively and prevent cholesterol buildup. Other PCSK9 blockers already exist, but they require regular injections, which makes this oral version a major step forward in terms of convenience and patient adherence. High LDL cholesterol isn't just a problem for people with HeFH. It affects tens of millions globally and can lead to serious complications like heart attacks and strokes by clogging arteries and restricting blood flow. The trial also showed improvements in other key heart health markers, suggesting that the drug's effects may go beyond just lowering LDL-C.
What happens when you drink a milkshake packed with 130 grams of fat? In a recent study, scientists fed exactly that to a group of people to see what it would do to their brains. The drink, which they called the Brain Bomb, was mostly made of heavy cream and mimicked the fat content of a typical fast food meal. It had over 1,300 calories and more than 4 times the recommended daily intake of saturated fat. Researchers wanted to know how this kind of high-fat meal affects blood flow to the brain, and the results were not great. Just 4 hours after drinking it, both young and older adults showed reduced blood vessel function, which made it harder for the brain to regulate blood pressure. This can limit how well the brain gets oxygen and nutrients, and over time, it may increase the risk of stroke and dementia. This effect was worse in older adults, who already tend to have stiffer arteries and are more vulnerable to changes in blood flow. In their case, the brain's ability to adjust to shifts in blood pressure dropped by about 10%, just from that one meal. While previous studies had already shown that high-fat meals hurt heart health, this is one of the first to show the immediate impact on the brain. The study did not test memory or focus directly, but earlier work by the same team showed that fatty meals boost harmful molecules in the blood and reduce helpful ones like nitric oxide, which keeps blood vessels flexible. So while the occasional greasy treat will not hurt you on its own, this research suggests that even one high-fat meal can affect your brain's blood flow within hours.
Scientists used cholesterol as a Trojan horse to deliver